Hi, I'm Dr. Jim Sanders from Rochester, New York, and I'm here today to speak to you about scoliosis casting. So each cast is made individually for each patient. We have a special table on which we place the patient. It allows us to have full access to the patient's body. And then we apply traction, both through the head as well as through the pelvis in order to stretch out the spine. We apply a soft layer underneath, and then we apply a hard layer. We usually make that hard layer out of plaster. Sometimes we'll use something like fiberglass if we're trying to make it a waterproof cast, but in general it's made with plaster, which has a lot of really good properties for us to be able to use. And then we apply pressure, and it takes a lot of hands to apply all the pressure in the correct spots to mold the cast, to get the curve corrected by pushing in the right places. Well, the cast comes off when we change the casts. We generally leave the cast on for 2 to 4 months, depending upon the age of the child and how much correction we're getting. If you take off the cast, you lose a lot of its corrective technique. People like to use scoliosis braces because they're easier to take on and take off, but it's really hard to apply those same molds if we take it on and off like a brace would be. Parents always figure it out somehow. Sponge baths and trying to do things like that seem to work out really well for most families. Sometimes the cast gets soiled, and if the cast gets soiled, parts of it can be trimmed, and so we can help families when that has happened. Once in a while, the cast will get so badly soiled that we have to change it, but that's pretty rare. In general, most children are going to need to undergo casting for at least a year. So that means if the child is having a cast changed every 2 months, that's 6 casts for a young child. For a child who's a little bit older, it might only be about 4 times during that year. But some children undergo casting for a longer period of time. Other children might have times when they need to come out of the cast for other procedures, and we have to go back into them. The cast cures some children who have scoliosis. Our figures overall is that it cures the scoliosis in about 25% of the children. It tends to be cured more in the children who start casting at a younger age, somewhere around 18 months to 2 years of age or younger, and curves which are smaller, and we measure those in degrees, usually curves which are less than about 50 degrees at the time we start. For many children, we do not get a full correction of the curve, and it doesn't completely go away. We're gradually beginning to learn how these children do over time. Some of these children will continue to have slow resolution of their curves. Some children's curves will hold stable for a long period of time, and other children, which is fairly uncommon, will have rapid progression of their curve, and they end up needing to have surgery relatively early. If we can delay the surgery, it really seems to have significant advantages to the child over time, and that's our preference if we can do so. If the cast gets broken, then we probably need to repair it or to replace it. And if you don't want to leave on a broken cast because it can rub sores pretty badly. Families ask about breaks and vacations from the cast quite often, and we do arrange for families. Once in a while they want to go to the beach and have their children spend some time in the water. We will have a brace molded for them when we apply the cast, take off the cast, let them go do their vacation, and come back and reapply it.